It is sick. Good evening to all our colleagues joining us across India and across the globe online. Today, under the leadership of ISCCM, we celebrate not just Women Day, we celebrate women who hold life between breaths. Today is not about applause, it is about acknowledgement, it is about equity, and it is about voice. With this, I call upon our President, Dr. Ranveer Singh Tyagi, to welcome all on board. Over to Dr. Ranveer.
Thank you, Dr. Deepthi, and thank you all for joining on the times. So, good evening, respected senior. Dr. Sheila has joined or not?
Not yet. Not yet.
So, office, Chirag, please remind to Dr. Sheila.
Yes, sir. 2 minutes में कर रहे हो, sir.
Please call him. So,
Yes, sir.
good evening, respected senior and distinguished faculty, dear colleagues and friends. Pranam, Namaste, Radhe Radhe. It's my great honor and privilege to welcome all of you to this special ISCCM webinar celebrating International Women's Day. So happy Women's Day to all beautiful ladies. This year's theme is Give to Gain when women leads. Actually, this is beautiful reflection and important truth in healthcare. Women have always been at the forefront of patient care, research, teaching, and leadership. Their dedication, compassion, resilience, and commitment to service continue to strengthening our healthcare system. In critical care medicine, women are playing increasingly important role as a clinician, academicians, researchers, and leaders. The example is our so many leaders at the global level sitting on this webinar. Their important contribution not only improve patient outcome, but also inspire teamwork, empathy, and excellence within our profession. Today, webinar is an opportunity to recognize, appreciate, and learn from the inspiring journey and experience of our esteemed women leaders. Their insights will guide and motivate the next generation of healthcare professionals. As a professional society, ISCCM remains committed to supporting equality, mentorship, and leadership opportunity for women in critical care. When we empower women, we empower the entire healthcare system. Without women, the healthcare system is not complete. On behalf of ISCCM, as a president of this huge society, I extend my warmest welcome to all our respected speakers from the globe and from India, panelists and participants who have joined us today. Your presence truly makes this program meaningful. Let us celebrate the spirit of International Women's Day by acknowledging the remarkable contribution of women in healthcare and by reaffirming our commitment to inclusive and supportive professional environment. Thank you all for being part of this important celebration. Wishing you everyone a very happy International Women's Day. Thank you very much. Thank you.
Thanks, Dr. Ranveer, for sharing your words of wisdom and your vision. Now I call upon Dr. Chinu Agarwal. She is a renowned international psychologist and a psychotherapist. She is the director of Feeling Minds and president of ISMA, trustee and research head of HEMA Foundation. She has so many laurels that if I start reading her CV, its time is going to be very less for that. So Dr. Chinu will be sharing her views on what women give to healthcare. Over to Dr. Chinu Agarwal.
Thank you so much, ma'am, and good evening, everyone. Let me wish you all a very happy International Women's Day at the outset. Just give me a minute and let me see whether I can share my PPT. If yes, then we will go through it. Otherwise, I'll just go without it. Yeah, I think I'll be able to share it. No. I'm outside and I'm joining from my phone, so I don't think I am in a position to share my PPT. But I have made a few slides indicating what kind of role women are playing in the global health force. And to my surprise, when I looked at the statistics, 90% of the global health force, especially in the ICUs, is made of women, because most of the nurses and midwives are women besides the doctors. And when I looked at the statistics of India, 38% of all critical care doctors in India are also women. And so, as Dr. Tyagi said, that healthcare without women is incomplete. I guess if we keep the women out of the healthcare system, there's no healthcare system at all. And so, with this crucial statistics, we understand that women are playing a major role. And as he also in his introduction touched upon a few qualities that women are bringing into health force, that is the empathy, clear communication, sustained patient care. They talk, so there is a organization in India called as NABH, which is an accrediting body for quality assurance of hospitals in India. And they do some ratings. One of the pillars of the ratings is communication in healthcare. And they notice how much time a doctor spends on talking, just talking to the patient and their relatives, the caregivers. They have noticed that even if the time of communication increases by 1.5 minutes, the total outcome of the treatment changes drastically. This is what women are bringing into healthcare. They talk more to the patients. Why do they do that? And why is there a difference between what the other gender is doing? Is because the empathy quotient in women is biologically different than that in men. Men are not at fault. Men operate more from the technical point of view, while women operate from the tender care point of view, and that is why they choose to be a doctor. When you ask a girl in a school that why do you want to become a doctor, her answer to that question is different from what a man or a boy will answer. So they bring this feminine qualities of tenderness, care, compassion, empathy, sensitivity to the healthcare system. But that's not all. The research and the statistics are also pointing out to the exceptional leadership qualities in women, especially because they're able to maintain a cool and calm, composed attitude, especially in the ICU, where critical decisions have to be made. And this is directly linked to the overall patient outcomes. Now, why this is so? Again, biologically, women are more resilient. But then, with all these positive qualities that women are bringing, into the healthcare system may not always do justice to the women's role. And as Dr. Deepti Mala mentioned, a very important word, that is equity. We still see less women overall in all the professions in the world in leadership positions. And so is the case in critical care as well. When we know that they bring in some natural qualities, they bring their sincerity, their hard work, their diligence, the dedication, the passion into, and also the deliberate and capacity for rational thinking into this profession, the systemic structural encouragement is what is needed now, and we need to be a voice. Our men are going to be an equally important voice as much as our own voice is going to be in this area. But besides this, I also want to touch upon the vulnerability that women bring in. The statistics, according to WHO, is that depression is twice as common in women as in men. Anxiety is more common in men than in women. And the combination of depression and anxiety disorder is again more common in women. Suicidal ideations are more common in women. Again, there are all three reasons why this is so. The biological, etiological factors, the systemic factors, and the social factors that the women are dealing with while they are working. One of the things that I heard very recently, one of the women leaders, the president of Women for Neurosciences, talking about at NIMHANS, where I was attending a conference day before yesterday, is that women have a habit of doing one more thing. So when they go out for some work, they will say, let me do one more thing and then I'll get back. When they are in their OPD, they will say, let me do one more patient and then I'll go back. When they're teaching to their children, they will say, let me teach them one more chapter and then I'll go back. So this doing one more thing keeps them in the loop of continuously stressing themselves out, leading to burnout, leading to mental and physical exhaustion. And so one thing that women need to learn to do in their personal as well as professional lives is to know when to stop, to create and maintain healthy boundaries for their own physical, emotional, and mental health. Now, that is easier said than done because they also tend to naturally shoulder more responsibility. They want to be perfect in all the roles that they are playing. And I have one very, very close person from your group whom I have seen from childhood. She's Dr. Indrani Hemant Kumar. She's my auntie. And I have seen she has been an accomplished cook. She has been an accomplished anesthesiologist. She has been in leadership positions all throughout her life. She has been an accomplished Bharatanatyam dancer. She has been an accomplished mother. And I've always found her, whenever she used to come home, immediately she used to enter into the kitchen. And even if her family members used to say that sab ho jayega, we will take care of it, she used to say, no, I have to do it because I do it better than any one of you. So you just stay, give me 10 minutes. I'll make all the idli, dosa, everything ready for you people. Whenever we used to visit her home at Mumbai, she used to, can you imagine? She used to pack our tiffins for the train also before leaving for the hospital. This is the syndrome of doing one more thing, and that too perfectly every time. Now, WHO has declared a pandemic of sleep deprivation, a pandemic of loneliness. My dear friends, if we really want to preserve our own human intelligence, our brain health, and also our physical, mental, emotional health, let's start celebrating ourselves by caring for ourselves. Unless we start doing that, we will not be able to sustain longer, sustain in a way that is more effective, satisfactory, and full of contentment for ourselves and our own careers. This is, I think, the message I want to give to all the women out there in the healthcare system and outside that as well. Thank you so much.
Thank you so much, Dr. Chinu, for enlightening us on what women give to healthcare. With this, we move on to our next segment, Voices from the Frontline. Here we have with us a young nurse. We want to hear from her. We'll try. Everybody, please try to keep to the time. 4 minutes each for the speakers now. Tamil Bharti. She'll be speaking on compassion and patient-family connection. After her, we have our first female president of ISCCM. Welcome, Dr. Sheila Naina Maitra. And she'll be speaking on mentorship and leadership. So I'll first ask Tamil Bharti to speak.
Thank you, ma'am. Very good evening to respected dignitaries, distinguished panelists, and my dear colleagues joining from across the world. I'm Ms. Tamil Bharati, MSc Nursing, Medical, Surgical, and Critical Care Specialty. Now I'm working as an intensive care nurse educator, researcher from Srihar deemed to be University, Chennai, Tamil Nadu, India. Yeah, it's a great honor and privilege for me to participate in this panel as an international faculty member. I extend my gratitude to the ISCCM team, President Sir, and my mentor, Dr. Ditimala Agarwal, especially for this opportunity to celebrate women's leadership in critical care. Today, I will highlight the importance of the compassion and patient-family connection in transforming healthcare and share my own experience also. However, Madam said, the recent research Ahmed et al. 2024 and many other research studies also consistently shows that the compassionate care improves the patient's and family experience, and it also reduces the anxiety, and it builds the trust between the family's healthcare team. I will share my insights on 3 major key objectives. One is compassion is the invisible medicine in critical care. The second one is patient-family connection is the art of the holistic critical care. My personal experience of compassion during the pandemic also. Working in the intensive care environment has taught me one powerful truth. The critical care units are the place where the life hangs in a delicate balance. The patients are often unconscious, critically ill, and surrounded by many advanced machines and complex medical technology. But the outside of the ICU door, there are the families waiting. They are hoping, they are fearing, crying, praying. So the most life-saving force is still human compassion. The compassion in ICU practice means how we are listening with patience, how we are communicating honestly, how we are communicating sensitively to the patients and patients' attendants' family, and acknowledging emotional suffering. Supporting families during the uncertainty also a compassion. As the legendary physician William Osler once beautifully said, the good physician and good medical practitioner treat the disease, but the great physician treats the patient who has suffering from that disease. So, the compassion therefore becomes an invisible medicine that supports healing the beyond technology. When a patient is admitted in ICU, the whole family experience emotional trauma. Families, they are facing fear, confusions, uncertainty about their survival in future, recovery, and any other things. This is why the patient and family connection is very essential in critical care practice. And it is done by the female gender, as ma'am said, comparing the male gender. Healthcare professionals must act as a bridge between the medical knowledge and human understanding. These connections can be strengthened through the transparent communication, family centered care, especially, and emotional reassurance involving families in care and decision making. In many situations, the women healthcare professionals play a pivotal role. They're strengthening this connection through the empathy, as ma'am said, resilience, and emotional intelligence. During the COVID 19 pandemic, I worked continuously in intensive care unit. For more than a year, I stayed away from my family. Every day, we have seen many deaths. I have worried about my own health also and safety of my family, my mother, father, and loved ones. But in the mid of the dark moments, something extraordinary we could emerge. That is the power of the compassion. So families, they were not allowed to enter the ICU during the pandemic. During that time, I truly felt that my power of the compassion and strong connection with the patients and their families made people viewed me as a protective figure. So, I will conclude my talk by sharing my three final message. One is by strengthening compassion and patient family connection, a woman in critical care, we can ensure that even in the most technologically advanced ICU, the human dignity remains at the center of the care. And the second one, on this International Women's Day, let us celebrate the extraordinary courage, resilience, and leadership of women working in the critical care around the world. May we continue to inspire the next generation of clinicians, nurses, and all other medical practitioners to lead with the knowledge, compassion, and humanity in the critical care setting. Thank you.
Thanks, Bharti. Now I'll request Dr. Sheila Mehta. She's the ideal person to speak on mentorship and leadership. She has led by example throughout her life.
Thank you very much. Hello, friends. At the outset, I would like to wish all the women on this webinar a very happy Women's Day, and also all the women in your lives. So over the past few years, ISCCM has been celebrating nationally this International Women's Day. And I'm really happy to say, and I commend the President, Dr. Anvit Tyagi and Dr. Diptmala Agrawal for taking it one step forward and including not only national, but also international leaders like Madis and Shelly, and not only including doctors, but also nurses and other paramedical staff. So I think this is really one very big step forward, and I feel really delighted and honored to be a part of this program. So I want to start with, I'm going to be speaking about leadership and mentorship, but I want to start with a bit of a personal story. And as I was introduced, first female president of ISCCM. So when I was introduced like this all the time, actually, instead of making me happy, it made me a bit sad. Because I used to think, I'm here because of what I've achieved and because of who I am, not because I am a woman. And when I became the president, I had a lot of women come up to me and say, you inspire us. We have been part of teams, but we've never been leaders of those teams. And, you must help us. You must do something. And this is when I realized that I have a larger role to play than just being the first female president of ISCCM. And that's why we took the decision of forming the first diversity, equity, inclusion DI committee for the ISCCM. And to make sure this was not just for 1 year, we included this in the constitution. And through the DI committee, we were able to achieve a lot of things that to take women forward in terms of mentorship and leadership. We also not only have this in the constitution, but we also framed an ISCCM policy for the DEI, which is on the website of our society, which talks, and from the women's point, it's not only, of course, for women, it's also for younger individuals, also for bringing more regional representation into ISCCM. But I'll talk about just the women, the policy related to the women, and it does talk about mentoring women, bringing them forward, representation in all committees in proportion to our membership, which is close to 30%, also encouraging them to stand for election and having various mentorship programs. Now, when I think about mentorship and leadership, I think about, certain goals or targets that we have to set. So, when women told me we should have quotas, we should have this, I'm completely against any form of quotas, because I don't think women are any less than men that they need some quotas. Yes, there is a problem. So we have to address that. And for me, what is important is a target. Okay, if it's 30% now, let's try to make it 40%. Let's try to make it more by the next year. So I think for any of these committees, setting a goal or a target is really important. To have structured, mentorship programs by the DI committee, I would really urge the DI committee to take this forward, is, I think, very important. To have workshops, not only on communication, leadership, shadowing leaders. We have, senior members like, say, Dr. Prachi Satya and others, just shadowing them, observing them, learning from their experiences, people and different types of workshops that we could do, and how to mentor people. It's not just about, okay, let's stand for election or put a woman here, but, there's always that imposter syndrome. So how to get over this, how to make them more confident to stand for this position, so that people say, oh, she's there because she's a woman. You shouldn't have to hear that. You should say, oh, she's there because she's really very good. Now, more than mentorship, I believe in sponsorship. Sponsorship is very important. So you have to, not only mentor the women, but you have to actually sponsor them to break this kind of problem that we have. Recommend them for position, bring them forward. When I was president, I tried to bring all the dynamic women forward and, put them in various positions. And I think this is very important. Recommend them for committees, recommend them, put them in various places. And this, being in those positions and being in leadership roles automatically inspires other people to join these positions. When they see more and more women, they think, oh, even I can do that, and probably even I can do that better. I think being part of women's networks is very important. And over the last few years, we have the Indian Network for Women in Critical Care, that is called Bold and Bright, which is very active, sponsors, mentors, a lot of things, makes women aware of what is there, what positions they can apply for, etc. And we also have the IWIC, that is the International Women in Critical Care, which is also a very powerful body. So I think being part of these networks becomes also important, to be aware of what is happening and, how we can take ourselves forward. I think we have come a long way from where we are. When I see young dynamic women, like Diptimala, Sharmili, I see Gunjan, Neeta, Gunchan, many other women on this program, and also outside, it's really heartening, because more and more people are taking leadership roles. But we still have a long way to go in this regard. And I feel very happy that no woman who has stood for an election after I became president has ever lost an election. So, this increases the confidence. And I always think that you need to come forward rather than say, I'm not getting the opportunity. You need to come forward. You need to be committed, and you need to say, yes, I'm going to take this challenge and I'm going to do it, and prove yourself to be really good. And most of the people who have mentored me and inspired me have actually been men. So I wouldn't say that any man has ever pushed me away or, stopped me from, or kept me away. This may not be the same experience for all the women, but I think we really have to look within and say, let me try to make myself better. Let me try to go forward and stand, for positions and in, various leadership positions. And I think it's a very bright time for ISCCM. And I think we have many young, vibrant women who are looking, getting into positions. And I think this kind of, discrepancy that we had earlier, it's only a matter of time that it will be resolved. And I wish ISCCM and the leadership all the very best. And thank you very much for this invitation.
Thanks, Dr. Sheila. Thanks a ton. It's always a pleasure to listen to you. With this, we move on to our next segment, Sister Organizations Speak. So our first speaker is Cherly Chang. She's the President-elect of SCCM. She'll be speaking on what healthcare gains from women. So we have 3 speakers in this. Each speaker has 5 minutes each. Second speaker is Marlies Osterman. She is the president-elect of ESICM. And third speaker is Dr. Yash Javeri. He's a very eminent ISCCM member, and he has many leadership roles. So for this, over to Shirley Chang.
Thank you very much for the introduction, and I want to wish everybody a happy International Women's Day. And thank you, Dr. Raniv and Dr. Ghanshyam, to ask me to participate in this special webinar hosted by ISCCM, because I'm very honored to represent women in leadership. So in asking that question of what does healthcare gain, we've heard some very inspirational talks about women and what we do in that space, but we're gaining a very large, talented, expanded workforce. As we heard before, that without women, that's half the group, and we need to get that different perspective and the strengths we have. We know that there's a lot of disparities even in medical school that have caught up. So at least in the US now, there's more women enrolled in medical school. In Canada, there's more women physicians under 40. In the UK, it's about 50-50 for practicing women. But in critical care, we're still lagging 20 to 40%. And I think we heard from Dr. Chinnoy, it's 38% in India. So we need to catch up, because the benefits in that new perspective also shows in some of the evidence. So when I was given this topic, I kind of went back and looked at some of the literature. In a Medicare population, which is the elderly population in the US, the largest insurer showed that when women took care of women and men, so when they looked at almost 500,000 women, about 300,000 men in this Medicare population, 30% were taking care of women. And both men and women had a lower mortality rate when they were taken care of by those women physicians, and lower readmission rate, especially in the more severely ill, which is the population we see in critical care, obviously. And women benefited more. And probably the thought is that, as we've heard before from our speakers, patient-centered care, that many women have better, I'm not saying men don't, but the interpersonal communication skills, spending time. Historically, we know that male doctors have underestimated illness in women, and pain is often, and there's a lot of literature to show that pain is undertreated in women, and having gender concordant care is certainly very important for our patients. And more recently, just this year, they were showing in a publication that came in the Anesthesia, Critical Care, and Pain Medicine from France that in practice, there are studies that show that central line placement had less complications with women. ROSC was more likely. Sepsis was treated more completely in women with women physicians. And we know that teamwork can be better when women are involved, and just again, because of the communication. Research, we know historically there's much less first authorship. There's a lot of articles about that, but can be more innovative and impactful when you have that other perspective. And we've heard from Dr. Mantra that for the leadership positions, it's really important for the teamwork, and when other people see women in that lead role, the whole organization performs better. They've shown this in business as well. Apparently, companies with female executives outperform the market too. So we know that women bring a really important perspective. I think that we have barriers, and I think when we talk about trying to get more women into healthcare, into critical care, we know that there's that child raising, basically the biological issues that happen, the caregiving responsibilities that often fall to women. And I personally have seen where women who have been given opportunities to be first author, have editorial leadership, step back a little bit because of that. So I think it's going to be really important to help not just mentor, but give more advice and life advice to some of our colleagues to bring them up into the world of critical care and leadership. We know historically also burnout is higher in women because of, and we've heard from some of our other speakers, there's just that desire to do one more thing. So I think that that's important to also help others, younger people, understand that we need to be able to set our limits and our guardrails. I think it's so important. I'm very honored to be in my position because visibility is important. I think women seeing, I've had people come up to me and also say, you know, you've been a motivation because I never thought to be in this space, but it's really heartwarming to see that. So I think that being there, helping to attract more women to the field, they know, and I think in leadership, they've shown also that women leaders, even in medical schools or division departments, it helps recruitment, retention, career satisfaction, knowing that someone's there to help you network, sponsor. We've heard about mentorship from Sheila, and then career development. So find a tribe. And I think that, you know, whether it's local in your own hospital, I had a colleague who I was stuck in the ICU. She was working on a chapter, and she went to go pick up my child when I was much younger. We were much younger. My daughter called me up and said, "Is this lady here to pick me up? She's kidnapping me," I think. So it's really fun to be able to have people to help out as well. So also societal tribes, like Sheila talked about the DEI and ISCCM, that's very important. And then the social media, the WhatsApp Women's Intensivists in Critical Care. Again, people that you can get advice from. I see across the feed people talking about how they're managing childcare, those type of things. So ask for help and find the help, and find a workplace that the environment is supportive and flexible to be able to make sure that your family is also, you can support your family while you're trying to work through this. I found also coaching, just being able to, someone that helps you coach through this, and then stepping up into leadership. So whatever it takes to get you there, I think it's really important to try and get those opportunities. Let some of the things that are not so important to you go by, but find the help you need to be able to take some of these leadership roles that you can. So thank you very much for letting me participate.
Thanks, Dr. Charlie. With this, I request Dr. Osterman.
Thank you very much for inviting me to this important webinar. It really is a great honor to join you and to be surrounded by male and female leaders in the world. I also would like to congratulate you for taking up this topic so seriously. So for me, it is a great honor to join you as a leader in critical care, but I won't take up 5 minutes because most of the things which are close to my heart have already been said. And I just want to add with three things. Firstly, I'm very conscious that I'm in my position because I had a lot of support from women and men who helped me getting to this position, and I'm very grateful for this opportunity. And with that comes, in my mind, the absolute responsibility to help others, clearly women, but also men, anybody really who is seeking opportunities and has the skills, and this should be independent of gender and sex. And I think ultimately that's what we're striving for equality and equity, where, as Professor Maitra already said, it shouldn't be anything special that a woman becomes president or a leader or a CEO. There should be normality. It should not be highlighted as anything unusual. And I think that is our joint responsibility to make this normal, to normalize leadership independent of sex and gender. And my final message is really that to also remember that although we celebrate International Women's Day and we talk about the inequalities, there are actually many other groups, minority groups, who struggle a lot and need more opportunities. And I think jointly, people on the call, independent of sex and gender, it is our responsibility to look out for them. They may be hidden, they may be in minority groups because of factors unrelated to their gender, skin, beliefs, sexual preferences. And they need to be equally identified and helped. as we've been helped. And really, that's why I want to finish. Equality and equity independent of sex and gender needs to become normality. And with that, it's our responsibility to move on and take this on as our objectives for the future. Thank you for your attention.
Thanks, Dr. Osterman. With this, I request Dr. Yash Javeri to share his views.
Thank you, Dr. Deeptimala. Critical care owes a lot to women, and the question which I have been proposed is what females bring to critical care. They bring almost everything. Their persistence, their perseverance, their passion. If this is missing in the ICU, no patient will go home. Because most of our workforce are female, as already highlighted, we just cannot imagine any of our ICUs without a female colleague. They will not work, they will fall flat. The nurses, intensivists, dietitians, pharmacologists, respiratory therapists, psychologists, most of them are females and they are the backbone of our ICUs. Their contribution defines the culture of the ICU. The discipline, if there is a female colleague around, we are much more disciplined. The precision and the quality of care. Nurses and our female intensivists, they remind us that devil lies in details. Attention to microscopic details. This is a quality which females have by virtue of their upbringing and by their genomics, whatever is the reason. This actually saves lives in ICU. No big thing saves lives, but multiple small things done right in the ICU only saves life. So attention to details is must. This we learn from our female colleagues, from our wives, from our daughters also. Interestingly, critical care medicine is the only specialty where care comes before medicine. So knowledge and skill is important, but what is more important is care. And who's more caring than a mother, a sister, or a daughter? They are the most caring persons in the world. They have embodied the principle of caring every day. From their childhood days till they are actually very old, they still want to care for the family. Multitasking ability at home, at profession, in the market, everywhere they have immense multitasking potential, and we perhaps if have 20-30% what they have will be great. Human connection and empathy, who knows it better than our female colleagues? Empathy is their quiet strength, which we try to imbibe from them. The discipline within teams with the female colleagues, this strengthens the coordination, which ensures that the protocols translates into practice. And perhaps, and most important skill, which is a vital skill for our day-to-day practice, is ability to let it go. They let it go. They let the patient die with dignity when the time has come. And we all understand communication is the holy grail in the ICU. And who communicates better than our female colleagues? So because of women, critical care medicine is not just technically advancing, it has become more observant, more human, and more resilient. So this is my take about what our female colleagues, nurses, intensivists, dietitians, psychologists bring to intensive care. They bring almost everything to intensive care. Thank you, Dr. Deeptimala madam.
Thanks, Dr. Yash. With this, we move on to our last segment, the panel discussion. What should institutions give back to the female colleagues? I'll call upon the moderator, Dr. Sharmili Sinha, and all the panelists, Dr. Prachi Sathe ma'am, Dr. Pradeep Rangappa, Dr. Saraswati Sinha, Dr. Kamalpreet Sodhi, Dr. Arindam Kar, Dr. Kunjan Paul, and myself. I'll be the panelist. Over to Dr. Sharmili Sinha.
Thank you, Dr. Deepti, and it's really pleasure and delight to hear the words of wisdom and from the eminent critical care leaders in the field. We heard that how female healthcare professionals dominate the field, and still in critical care we are at 38%. That's probably the Indian statistics. But in Indian Society of Critical Care Medicine, as Dr. Sheila Maitra rightly pointed out, we started this DI committee. Number-wise, in terms of life member, 33% of our members are females, but we are yet to see more number of female young special intensivists coming up to the forefront and occupying the leadership positions But this DI quotient has been constantly improving in the last couple of years, I must say. And with that, we start our panel discussions about institutions, because we are comprising a larger percentage of healthcare professionals. But what do institutions have to give us back? So I would welcome our panelist, Dr. Prachi Sathe. She is one of the senior most intensivist of the country, comes from Pune. Prachi ma'am, are you there? Dr. Prachi, are you there? Please unmute yourself.
We don't see madam.
Nayan. Oh,
No,
she's
दिख
not
नहीं
there.
रही, sorry.
Okay. So I would move on to our next panelist, Dr. Saswati. Do you think the institutions truly offer equal opportunity, or do you think there are still barriers in that? Dr. Saswati.
So good evening. It's really been a pleasure listening to all the leaders. And like you mentioned, Dr. Sharmili, although aspirationally institutions do offer, they claim that they provide equal opportunities, but still some barriers do persist. Because critical care is such a difficult specialty with long working hours, high burnout risk, night duties. So even despite the fact that more women are entering the critical care training and have comparable academic skills and clinical competence, but still I think there is a lot of discrepancy as far as leadership representation, work-life balance, demanding training years especially, and institutional support, especially in difficult situations when they require some time off for maternity or caregiving phases. So, despite the fact that the intent might exist, but I think there are still certain barriers to overcome before we achieve equality.
So, to name a few, do you like to see in the current context that we have made progress, but what are some barriers that you think are existing and could be overcome?
So I think although everybody, like we said, all of us think that women should be equal. Although maybe the intent is there, but as far as policies are concerned, there should be more, comprehensive policies. There should be equitable opportunities to hire women, promote women in leadership policies. Even if you look at, the payment status or the salaries. So unfortunately, there is still a significant barrier. If you look at, there is a significant discrepancy. At least I would speak about that in the Indian scenario. So the institutions must actually look into these issues and try to make it more equitable. Only then I think, and these should be as a part of the policy rather than, differentiating between whether a woman can earn the same amount of money or can hold a similar position as a man.
Thanks, Dr. Saswati. Dr. Deeptimala, you have written a wonderful book on women. I'm holding that book here, Indian Doctor Warrior Woman, and I think most of us got this in our conference Criticare Chennai in our conference bags. So would you like to also talk about cultural barriers? We are talking about institution barriers, but home is also an institution, isn't it? It is the first institution where all of us are exposed to. So would you like to talk a few about what are the cultural barriers do you feel that women face in our context or globally?
Yeah, definitely there are cultural barriers. And when I've been part of the DEI committee, and when I was going through the various, we were conducting the seminars. So everything which was, we were thinking of professionally. So very important thing is ki at the personal level, it hits first. So a lot depends on the cultural background you come from, the house you are in which you are bringing up is, because your mental status, your mental conditioning is according to the environment. So definitely culture plays a major role.
Sure. Thank you. Dr. Gunjan, are you there?
Yes.
Dr. Gunjan Paul, yeah. Dr. Gunjan is a senior intensivist from Ludhiana, DMC Ludhiana. So if you imagine a workplace which is friendlier and more compatible for women, what is expected or what is mandated for such an institution, if you just like to enlist?
Good evening, everybody, and thank you, Dr. Shamili, for this. And I'm very happy to contribute to this wonderful and empowering discussion which is going on. So, like women play a very important role in the society which is being discussed, or in the family. She's a mother, a daughter, a wife. So, similarly, in the professional life also, she's a researcher, a teacher, a clinician, a guide, an administrator. So, behind every successful man, we say there is a woman. So behind every successful woman also, I think a supporting family, which we say cultural background, so that is it makes her path very easy, and also very congenial working environment. So from the institution's point, they should offer equal opportunities, equal respect, equal freedom. And one policy, like I'm working in a professional medical college, so we have one mentor-mentee program that is right from the first professional. I'm not saying that attaching or pairing female doctors to senior female faculty. It is just there are about 100 faculty members that have opted for this program, and each is mentoring about 10 students. So all through their first year onwards, they are attached to this. So they help them navigating the path in their future life. And even the alumnus, we have alumni meet every year. So the alumni are also invited to mentor them. So as abroad, those who are from the international point of view, so that they make the path easier and struggle. So such inclusive culture of involving the students right from the beginning is a very positive move. And the second thing is I think it is not really very common. At least I have not faced it, but maybe some other places females are facing. Any harassment or bias as a policy, should not be tolerated and strictly punished. So it is not that female need some special treatment different from men, but they need their due dignity and respect. So the triumph, radiance, and strength of women should be celebrated every day, I must say, not only on International Women's Day.
Thank you, Dr. Gunjan.
Every day in our life.
Yeah, I think that's a mentorship program. I think it's an excellent initiative, starting right from the beginning. A student gets enrolled into the medical stream and onwards. It has a big role to play in handling all the possibilities of directions that we have been already discussed about. Having said that, I think in the context of the current scenarios, POSH, that is the Committees for Prevention of Sexual Harassment, is something that always have been existing in a constitution, in the provisions of the law, but its implementation at the institutional level has been somehow lagging behind. Attention has been drawn to this aspect in the recent years, and we had a couple of incidents, unfortunate incidents in the last few years, especially the incident in the RG Kar Hospital in Kolkata, and we had seen a widespread even global protest on that matter. This definitely highlights women's safety at workplace, more so for female healthcare professionals at workplace, because we do after hours, night shifts. So structural, infrastructural policies, and not only, and the provisions, everything is very much mandatory. Continuous audit should be done in these aspects, and any such complaint is raised, it has to be judged seriously, taken seriously. So public and
Suddenly, Dr. Ma'am Prati Sate has joined.
Yeah, welcome, ma'am.
I'm really sorry for the delay. There was some emergency.
Yeah, so we're just, ma'am, talking about the POSH committee, that Committees for Prevention of Sexual Harassment. It was already always existing, but I think more and more attention has been drawn to its implementations and the subsequent actions, which are also very much necessary. I think we are all, this is being taken note more seriously, even all public, private, in the smaller setups also, this is being taken more seriously, and something we need to continue to harp on in future. So, ma'am, that you have joined us, actually, I'd just like to highlight that many women leave academic career, of medicine mid-career years, especially the maternity leaves, once they become pregnant, and because usually they're in that age group of 25 to 35 when they go for the first pregnancy. And that is the peak period when they would have completed their graduations and they'd be obtaining or enroll into some postgraduate courses, and then comes the pregnancy and the maternity leave. How do you think this affects their career, and how institute should address these issues?
Yeah, I think this is one very important issue, because as you said, it is the exact same period where the family is being raised. At the same time, career is progressing. And at the time of interview, basically, it has been a practice. It has been observed, it has been obvious in our surveys also, that at the time of employment, the family status of the lady, the pregnancy status of the lady, the pregnancy plan or family plan of the lady is being interviewed. And this, I think, is a very, very unfair practice, because based on that, the selection or non-selection would take place for her. Similarly, for maternity leave also, even though there are national rules and legalities, still in the private sector, it is not much practiced or taken care of. In social situations, if we find that the men in this age group become much more free after having a family, whereas women get much more entangled because of the social pressures, family pressures, and the self consciousness also. And so in these situations, I think while joining back from maternity leave, we have to encourage them. We also should give paternity leave, which is helpful for a girl to come back and share the responsibilities. Thirdly, after coming back from maternity leave, there can be flexibility given to her. At least, instead of falling out completely, say 3 days a week or something of that sort can be, their talent also can be brought back and they will remain in the flow. So there are certain things which can definitely be modified to take them in the mainstream once again.
Thank you, ma'am. Is Dr. Pradeep Rangappa, is he with us? Has he joined?
I'm here, Shamli. Good evening.
Yeah, good evening. Good evening. Welcome. Dr. Pradeep Rangappa is from Bangalore and as a president-elect. So continuing this discussion about maternity leave, recently we know that Government of India has the provision of granting 6 months paid maternity leave and beyond that 6 months of unpaid leave. But when you come to private corporate sectors, there are various aberrations we see, and I myself have also gone through that. Having said that, there has been a recent Punjab High Court verdict about maternity leave for contractual employees, because we know about this provision of contractual doctors being hired in various institutions. So what would you say about that?
Thanks, Shamli. I think at outset, wish to thank our President Ranveer, Deeptimala, and Shamli, and wishing you all a very happy Women's International Day. So, Shamli, this is a valid point. I think as per our Indian law, we have a Maternity Benefit Act that came in 1961. And I think this was amended in 2017, where 26 weeks of paid leave is something that is a right for a pregnant woman. But as you rightly said, these are grossly lacking in our corporate or private sectors. Because most of our intensive care workforce, which represent, belong to the private sector, and this surprisingly seems to be lacking. And this is something as a organization and as an ISDCM, we should possibly think of taking it forward, because there are 3 things that are very clearly laid out: that there should be 26 weeks of paid leave, and there should be creche facility. And seldom we see many of our female workforce in our hospitals do not have the provision of child care. Because Sharmili, you were in Australia, you recall I was in Australia, every hospital had a creche where the child care was provided for the children of the staff working there. And this is very abysmally lacking in any of our hospital setup. And maybe work from home provision, because that facility to some extent, if it could be provided, I think these gaps could be addressed. And as you said, for the contractual doctors, even in the government, I think this particular act is at this point of time not applicable. So covering paid leave for 26 weeks is something that is lacking. And another important factor which affects this, which is affected with the maternity, is the career progression. I think you would sort of agree that most of the promotions get delayed, and their research sort of the projects get delayed, and the timelines also get affected in their career progression and promotion. So these are all some of the limitations which should be factored in when some sort of a policy is undertaken in private and in the government hospital. I think this is the need of the hour, and especially in private, we should be advocates for having some sort of a policy for paid leave, even in private, having creche facilities and some provision of work from home, so that their absenteeism is sort of well taken care of from the institutional standpoint. These are my submissions.
Thank you,
Yeah.
Dr. Pradeep.
So
Yeah, ma'am.
creche can be outsourced also in the nearby area, because the corporates will not like to take the responsibility, because again there are a lot of legalities. But nursing colleges are also associated, and then there are some kind of creche facility outsourced can be definitely made available. Now working from home is going to be very difficult for the women in critical care areas, because we always believe in hands-on things, but we can get them involved either in research or administration, or
Or maybe
calculating some
tele-ICU,
data,
madam. Tele-ICU also
or
facilities. If
tele
we
ICU
can
facility.
ICU that
Yes, that's a
clearly.
very good idea. Tele
Uh,
ICU facility.
I'd like to add few things to which Dr. Pradeep
Uh,
mentioned. This is actually,
Kamalpreet is Kamalpreet is thing. Kamalpreet panelist.
I'm coming to her. We just next, she'll be there. So just addition to this point which Dr. Pradeep mentioned about this latest verdict this is from Bombay High Court. Pardon me, I said it is Punjab High Court. It was Mumbai High Court. And this was regarding a case filed by one of the junior resident doctors who is working in one of the reputed public hospitals in Mumbai. And they had clearly said that maternity leave is a fundamental right to life and dignity, Article 21, and prohibiting employees from denying benefits based on contractual, temporary, or daily wage status is not acceptable. The court emphasized that due to technical breaks in service, it cannot be used to deprive this woman from maternity leave pay. Hence, this is the newest development that contractual woman form of agreement does not deprive a woman who has been working continuously in an organizations more than 6 months, even with some technical breaks due to renewal of contracture. It may be a few days or few weeks. That should not deprive the woman from getting maternity leave. And this is something I think from all youngsters, all young intensivists who are working in the field to take note and should claim their rights for the same. So I come to next Dr. Kamalpreet. She is a renowned intensivist from Ludhiana and currently one of the vice presidents. Dr. Kamal, are you there?
Yes, good evening, Dr. Shamili.
Yeah, good evening. So we heard all what we expect the institutions to give back. So you have been in a senior position, leadership positions. If you would like to change one particular policy in your institution tomorrow, if you have that authority, what would you do?
Okay, so you had a difficult question for me. Actually, what my thought is, like, it is just echoing my previous speakers. Like, if I had been into this position that I can change one policy, my thought will be on changing a shift from which we have the rigid gender blind scheduling. The staff modeling is typically very rigid. So we should have a staged, flexible re-entry schedule sort of for the staffing model. Means that right now what we are pursuing is either 100%, like wherein we have the 24/7 working schedules, night duties, and the typical high intensity rounds we have, or we are on leave. So it should be, especially for the younger generation, like it should be sort of a non-linear career track, wherein we can opt for overnight calls, opting out of the overnight calls and coming back without any loss of trajectory should not be there. What Dr. Pradeep and Dr. Prachi were saying, that the academic loss when we have the maternity leaves, or we go in for some like elderly care, even we have to, not only for the child, we have to care for the parents also. So the elderly care should also be a part of it. And once we re-enter, there should not be the loss sort of. So we need to have a non-rigid structure. So this is one policy I would like to, change in the institutions.
So
And it should be like, rather than just aiming for a sprint, it should be a marathon. We should treat the physician's life as a marathon, that we need to have some breaks around. So this can be a part of. I know it's somewhat unreal, but this is one thing I do wish.
It is quite possible. It will actually reduce the loss of talent also.
Ma'am, that's an optional thing. What we think, we do want to take breaks, but from the institutional policy, we are always at a loss.
That's true.
Academics people have to leave their post graduations in between, or they have to, like, they opt for the fellowships or something, and then they have the maternity breaks, and so there is a loss.
So work norms should also be individualized, like everything. Very valid point. Very new point.
So Dr.
And
Kamal,
then these are on. Sorry, I'll just make one.
Go ahead.
So all this on paper also, if we can bring it, is very nice. But it was mentioned by Dr. Pradeep, all the legalities on paper. But while interviewing, there are very subtle points. As I had mentioned, that if a girl is recently married or thinking going family way, then without saying anything, without any norm, subtly the opportunity to start working on itself or giving any opportunity to study further courses is denied. So these things have to be, bystander intervention, as we say, that some people in the committee should bring this up. And these personal things should neither be asked to women or men.
Well, certainly, ma'am. This is actually now prohibited by law also, that this kind of questions cannot be asked in the job interviews, and it can be very much legally objected to. Point well taken from Dr. Kamalpreet, and I think she pitched for flexibility. Now, then, not only in work hours, also the pattern of work hours. Like you can choose a combination of research, clinical work, and now thanks to technology, we have this provision of tele-ICU also, which can actually give a permutation of combination of options for continuing your career in a critical care field without actually diminutions later on when you are coming back to the floor. So point well taken, Dr. Kamal. Next would like to ask Dr. Arindam Kaur. He is currently our Vice Chancellor of the Indian College of Critical Care Medicine. Dr. Arindam, are you there?
Yes. Good evening to all. Yep.
Good evening. Welcome. So there have been policies we have been hearing for women employees at workplace. Of late, what in my experience of around 16 years in India, what I've seen is these two committees or the two policies on POSH and DEI. They have been lacking in most of these private and corporate institutes, and even for some of these public hospitals also. So you have been a person who has been very closely involved with quality and CAHO organizations. So are these part of NABH and part of internal audit?
The POSH committee, which is prevention of sexual harassment, is clearly included under the NABH from 4th edition itself. Now the 6th one is going in the standards as a part of mandatory human resource and legal requirement. So the HR, as after the Vishaka committee recommendations, every institutions, be it healthcare or non-healthcare, have to have the POSH committee. In healthcare, it is clearly indicated in NABH as an internal complaint committee, which has to be headed clearly by a woman itself. The composition can have men itself, but the lead person has to be a woman itself. And this not only that, for any sort of complaint and grievances, there has to be a written policy for the employee to reach out to the ICC itself. And not only the policy, the committee has to also make sure that the policy is known to all the employees itself. So not even in the paper, but into the functionality itself. And complaint anonymity of the complainant can also is an option, or at least there could be certain processes where the names should not be there. Regarding DEI is actually within the ethos of the NABH as well as JCI itself, but very clear mandate for having a DEI committee or requirement for audit has not been there. So I have been working in an institution which is a foundation, non-profit organization, which is led by both the chairperson and the CEO are women, and it is in the written policy of the foundation to have a woman-centric, more sort of inclusion in that. So we have more than 65% of our employees are women itself, and also the first audit has been done to find out DEI, the impact of DEI in amongst the employees itself, as well as now we are also looking into the case mix as well as the newer concept of DEI into clinical trials. We do a lot of trials and surveys itself that we are considering. Honestly speaking, the audit for DEI, we have just started. The results are yet to come.
Yeah, thank you. I think now we see more and more of formation of these committees, was mainly the POSH and also DEI is following it. But I think time to time there should be audit of how these things are being handled, rather than just being in pen and paper with in the coming times. My question to Dr. Prachi ma'am, how do you ensure women are not only present in but also heard in leadership positions? Because many committees, as been hearing, they are being increasingly being included. but their presence only do not matter. Are they being heard? Or if not, what are the barriers and what we can do towards that?
Yeah, I think this is a very, very pertinent issue. Before we go towards that, I would like to highlight that in our chat, Dr. Sheila has mentioned that all these points we have included in our ICCM DEI policy also. It is very important that all of us should go through that. So, answering to your question, Dr. Shamili, basically on paper, everything looks good, but while implementing it, there is a problem. Now, it was mentioned about DEI committee report by Dr. Arindam. Now, we have seen number of times that the reports are given that there are no cases, no abnormal behavior or any kind of things. But actual what happened, analysis of it doesn't come on paper because everybody is most worried about the reputation. Similarly, in day-to-day things, whenever there are meetings being conducted, being held, official meetings, or even on day-to-day rounds for that matter, the whole thing starts with kind of microaggression and untoward remarks, which are very subtle remarks. And if that is not nipped in the bud, then it goes to higher level, to even the leadership level, that there is the women are taken for the requirement of it, but actually they are not given enough voice or they are not even enough heard. And then there is a necessity that there are senior mentors or people who will interfere or who will stop any untoward comments then and there. So this is very, very important. It is most of the times felt that the ladies would not be able to take the new responsibilities or would not be able to handle the things. It is seen when we started the committee in ICCM also, it was a very odd comment I heard. Oh, these ladies are also speaking quite well. And that was a very, very subtle but meaningful and derogatory comment. So such things, when they are happening, it should be stopped there and there. Given enough voice to women is important.
Thank you, ma'am.
Thank you
for bringing up those points. My question to Dr. Deeptimala. Ma'am, you have written a very, are you there, ma'am? Dr. Deeptimala?
Yes.
Yeah, you've written a very wonderful book. I would again like to show that book about Indian doctor, warrior woman. I like the cover page, mainly the picture.
Yes.
Yeah, that has also been designed by me.
Wonderful. And, some of these also, most of us can relate to what we have been discussing since last 1 hour about being asked personal questions. And you also written in one of your chapters that you were asked during your job interview, like, are you pregnant? And that was a very straight question, I thought, this early 2000s. So what is your message for the institutions and for the women who are working in such institutions where they feel they are not being cared for or not getting equitable and representations? What is your message for them?
Yeah, I would like to say through my book, Indian Doctor Warrior Women, I want to convey simple but powerful message to all women that every woman, especially women doctors, they all are warriors. We fight many battles every day. We balance our responsibilities, expectations, compassion, sometimes our own self-doubt, self-guilt, which I experience at this age also. So yet we continue to heal, to serve, to lead. So this book celebrates that quiet courage. So it's a reminder to women that their struggles are not their weaknesses, but signs of strength. So at the same time, it encourages us to care for ourselves with the same compassion that we give to our patients. So my message is, believe in your strength, support each other, never underestimate the power of a determined women, and when women rise, the entire nation rises.
Thank you very much, ma'am, for your strong words of inspirations. And with that, actually, I would like to this opportunity to thank you, everyone, our President, Dr. Ranveer Singh Tyagi, Dr. Pradeep Rangappa, and all my esteemed panelists, Dr. Saraswati, Dr. Kamal, Dr. Prachi Sathe, Dr. Deeptimala, and Dr. Arindam Kaur, and Dr. Gunchan Paul for their valuable contributions. I think we all concur and conclude that not only doctors, all women health professionals, nurses, pharmacists, our allied health professionals, we all care more with compassion and courage. and we still need to be more included. I mean, there needs to see a rise in inclusivity in our workforces, and obviously, definitely, this future is safe in capable hands. Thank you, everyone.
Thanks,
Thank
Dr.
you.
Sharmili and all the panelists.
Thank
With this, I will request our secretary, Dr. Ghanshyam, to give the vote of thanks.
Thank you, everyone. Thank you, Dr. Deeptimala. At the outset, let me thank Dr. Ranveer Singh Tyagi, the president of ISCCM, for his welcome address and the brain behind this program. Dr. Deeptimala Agarwal for her opening remarks. I would also like to take this opportunity to thank Dr. Chinu Agarwal, Ms. Tamil Bharti, Dr. Sheila Maitra for their insightful contributions about the role of women on leadership, compassion, and multitasking. My sincere appreciation to the leaders from SCCM, Dr. Chang, ESCCM, Dr. Osterman, SNCC, Dr. Yash Javeri, for highlighting the gains of women on the broader aspects of healthcare and highlighting the broader DEI issues. Thank you, Dr. Sharmili and the panelists for an engaging discussion on the various aspects of women in healthcare. And finally, to each one of you who has joined us today and the organizing team from the ISCCM office, who are the the main people who have put their efforts in getting this program live today. And I wish all of you a very, very happy International Women's Day. Thank you very much.
Thank you. Thank you, Dr. Tyagi.
you.
And thank you, Dr. Sharmili.
Thank you, everyone.
Thank you, everyone.
Thank you.
Thank you.
Thank you all.
Dr. Tyagi, mute to up. Yeah.
I prepared this program after discussing with the Ghanshyam that today is the final match of cricket. So we will finish on the time. So
We
the
should have
program
ended
will
it.
finish on the time just because of the lot of women in this today discussion. So that is also quality of women. They are committed to time also. So again, happy Women's Day to all. My
Thank
salute
you,
to all.
everyone. Enjoy the cricket match.
Yeah.
Bye.
Thank you.
Thank you. Thank you.